It's in front of a blue screen.
Yeah, last time it was San Francisco. I don't know, maybe Rome.
It's just the background. He's actually in the bathroom.
I thought it was always good to keep you guys
Order,
guessing.
please.
Gotcha.
Okay, have we got you now? Can everyone hear us?
I can hear you.
Okay. All right, we apologize for that. That was an accidental disconnect. At this point in time, I'd like to call the monthly meeting of May 15th, 2020 of the Washington County Board of Supervisors to order. And Supervisor Clary, would you lead us in prayer, please?
Yes. Dear Father, we pray for all the families who have lost a friend, a family member, a husband, a wife, or a child to COVID-19. We pray for the doctors and nurses in the healthcare realm for their continual dedication and compassion in their new lives. We give thanks to all the farmers and the teachers and the students and everyone that continues to work towards a goal with persistence and good times. Please help us as we go into the next phase of reopening and know that you will guide us through that. Amen.
Thank you, Supervisor Clary. You join us in the Pledge of Allegiance. Dave, would you lead us in that, please?
Please rise for the pledge. I pledge allegiance to the flag
To the flag
United
of the
States of
United
America,
States of America,
and to the republic
and the republic
for which it
for
stands,
which it stands,
one
one
nation,
nation, under God, indivisible, with liberty
and
and
justice
justice
for all.
In case of fire or other emergency, those of you in the supervisor's chambers, please receive the nearest exit, find the nearest stairway, go down the nearest stairway, exit the building, and clear the grounds so that emergency squads can do their job. Thank you. Those at home, figure out your-
Mr. Hanky,
Here.
Mrs. Fedler, she's here. Mr. Ferguson,
Here.
Mr. Shaw,
Here.
Mr. Hall,
Here.
Mr. Losaw,
Here.
Mr. Hicks,
Here.
Mr. Ward,
Here.
Mr. O'Brien,
Here.
Mr. Half,
Here.
Mr. Campbell,
Here.
Mr. Skelly,
Here.
Mr. Hogan, Mr. Wilson,
Present.
Mrs. Clary,
Here.
Mr. Griffith,
Here.
Mr. Rozell.
Mr. Hogan was on the screen. Did he drop off completely? Tim, can you tell from yours?
I can't see him. They must have dropped out.
Okay. All right, at this point in time, I'd like to ask Tim Harvey to give us a COVID-19 response update, if you would, please.
All right, good morning, everybody. Going to run you through the quick update of the numbers and some of the latest information that we received as of this morning. So we're continuing to do our coronavirus information update at washingtoncountyny.gov/coronavirus, updating it with the latest statistics, county operations information as we continue to update change. Our e-newsletter goes out every day. Important links to the latest up-to-date information from the CDC and Department of Health. Our briefings for local officials and first responders, we're doing those weekly now. We're going to try to just continue those on Fridays at 3 p.m. and do the Tuesday one by email unless there's a need. As of late last night, parts of the New York State on pause Executive Order 20231 was extended through May 28th of 2020. That refers to about 7 or 8 other executive orders. There's a lot contained in that. Some of that's still being sorted through. The other thing that the governor did extend is the face coverings in public for those who can't adequately social distance, remains in effect through June 13th of 2020. The county state of emergency was extended through June 12th of 2020, and the executive order from the chairman extended through June 1st of 2020. And thanks to Office for the Aging for coordinating distribution of the cloth face coverings to the senior groups. We're still doing those by appointment through our office for anybody in your communities who's in need. Please have them reach out to us. If we get another large shipment, we are talking about doing a potential public distribution again. Statistic-wise, as of 9:30 this morning, we have 158 mandatory PUIs that public health is monitoring, 7 precautionary. We are up to 190 positive, 124 recovered, no hospitalized, the 13 deceased, 927 released, and as of this morning, 1,980 tested. You can see on the line graph there, we have plotted on there our PUIs, our COVID positives, our hospitalizations, and our COVID-related deaths since we started monitoring on March 9th. And those are plotted every 3 or 4 days, depending on the time frame, all throughout this, and we'll continue to keep track of those for anybody who's looking for that data as well. Just a couple other things. Just a reminder, the use of a cloth face covering is meant to protect other people from the virus that aren't infected. And it's important that you keep the covering on your face the entire time you're in public, covering your mouth and nose. And don't put it down around your neck or up any higher. Obviously, it's intended to cover your mouth and nose and best protect you and others. And the last thing that we would ask, we are still doing our Mask Maker Mask Up program with Warren County, where we partner with them to get members of the public who are interested in helping to make cloth face coverings. We have a drop box that's out in front of the Municipal Center Building B entrance that we empty every day. Anybody interested in making those, or if you can't get them here, let us know. We'll come get them. We get them over to Dr. Leach in Glens Falls. Him and his group are sanitizing them and then getting them back to us as well for public distribution. So we really appreciate anybody passing the word on that, and anybody in the public who's interested in helping, we would appreciate the help on that. And that's all I have, unless there's any questions.
Supervisor Shaw.
Yes, Tim, on your chart you have you've tested 1,980 people so far.
The county, we've had a total of 1,980 tested in the county. That's correct.
Now, what does that reveal the fact that they don't have it, or does it also tell you that they did have it or they're tested positive for it? What does that data?
So that data just shows that when a test is conducted, so there's been 1,980 county residents that have been tested to date as of early this morning. And of those 1,980, I believe we're at 190 of those returned positive. So that doesn't indicate whether they previously had it or obviously had it after their testing. That just indicates at the time they were tested, whether it was positive or negative. So 190 of those tests have returned positive.
Different tests for the, that looks back, Dan. It's a different separate test that looks for what the antibodies. This just tells you at that precise moment in time whether you've got virus or not.
I mean, does that mean you're, and I'm sorry, getting kind of this, does that mean that you're a carrier? Does that mean that you actually have it right now and that you should stay home is all it's telling you, or what's it? I'm just trying to understand that.
So what it tells you is, do you have the virus at that point in time? If so, we're going to tell you to stay home. We're going to then conduct the contact tracing part of it. We're going to talk to you, we're going to talk to other people, and see if we need to talk to them, okay?
Okay.
You should test, when you're done, the disease runs its course, you should test negative under that particular test. There's a separate test that will then tell you, so let's say you had the disease in March before anybody knew what it was, okay?
Mm-hmm.
And it ran the course, and now you're done. Now, then there's the antibody test, which will tell you, yeah, you had it before, okay? This is just, today, do you have the test right now when they swab you? If you drive away from the test site, go someplace, pick up a contamination, your test is going to come back negative.
Right.
See what I'm saying?
Yeah.
Or if you're not progressed far enough to have virus, active to where it can be tested, you may test negative even though you're just not far enough along the progression. So this is a one-time, one-deal snapshot. And for the most part, especially early on in the testing, we were testing people who either had close enough contact that we were worried about them, and or their doctor was, or they're exhibiting some kind of symptoms that could be associated with that, and therefore we are directing those people to the testing site to confirm or not whether or not they had the virus. Now it's opening up to people that just can walk up. So before you couldn't just say, I wonder if I have it, and go. You had to have a reason to be sent. Now we're slowly transitioning to the people that are just saying, I wonder if I have it.
Oh, so you take walk-ins then, basically?
Well, you still got to make an appointment. You just can't roll up to Warren County and say, "Hey, what you doing?" You still got to tell somebody you're coming. Hudson Headwaters is also doing tests, so you can call Hudson Headwaters office. I can't remember which ones. Tim might have the list there.
West Mountain and Warrensburg.
West Mountain and Warrensburg, and make an appointment and go. They'll test you as well.
So would it, Tim, be safe of these 1,980? Most of them, since you're just starting to transition, were people of interest, is why the test was performed on them.
All of the 1,980, or the majority of the 1,980, before the no need for a referral opened up, you had to have either a public health referral or a doctor's referral.
Right, so people of interest, yeah.
Right, so now that there's more public testing available, whether it's the drive-through in Albany that you can just go to, or it's the Hudson Headwaters, which are starting to let people in without a full doctor's referral or public health referral, that number obviously will continue to grow as there's more outlets available for public testing asymptomatic.
Thank you, Mr. Chairman.
Any other questions?
I see Mr. Haas here.
No. Supervisor Haas, did you have a question?
Yes, just a quick one. That link for the mask makers, can that be found on the county website? Where would I find that link? Or
That's the mask makers. The mask makers is posted up on the WashingtonCountyNY.gov/coronavirus. It's down under. There's a section in there for the Mask Up program.
Okay, because I'm looking for a copy of the flyer. I will find it there.
Yep, not the flyer, but I can resend you the flyer. There's a blurb of information with the logo header on the website, but I can resend you the flyer as well.
Okay, I want to send that out to my community, but on the bottom of all your messages, it always says this is confidential, don't share, which is a little bit silly because we want to share these things. But if you can send me the flyer, I would appreciate that. And if it says confidential, I'm going to violate it.
You've got a one-time waiver.
Thank you.
Any other questions? All right. The condensed minutes from the April 17th and May 1st, 2020 meetings are accepted as mailed unless there are any additions or corrections. Do we have any additions or corrections? Going once? Going twice? Going 3 times? We will now move on to communications.
For communications from Columbia County, we are in receipt of their resolution 160, calling on congressional delegation to provide counties with direct federal aid to support counties' COVID-19 response and reopening economic activity efforts. From Greene County and Schuyler County, we are in receipt of their resolutions calling on the state of New York to release enhanced federal Medicaid matching funds to counties in New York City. And also from Schuyler County, calling on New York State to restore state retirement service credits to Schuyler County workers who temporarily lost their service credits due to county's COVID temporary workforce reduction. Also received correspondence from a resident of the town of Jackson requesting removal of the hazard pay and a resident of the town of Whitehall in opposition to closing the parks. That's all I have for communications.
Thank you, Deb. Committee reports. Audit report?
Reports to the audit committee resolved that said report to the auditing committee dated May 15th, 2020, totaling $2,164,951.28. Being the same, hereby is in all respects accepted, approved, and adopted, and be it further resolved that the county treasurer be and hereby is authorized and directed to pay the several amounts set forth in said reports in a total of $1,154,980.46. And be it further resolved that be attached as a separate report in a total of $967,792.41 from the county auditor for the period April 15th through May 11th, 2020.
Okay. Do we have a motion moved up for acceptance?
Mr. Chairman, so move the committee report.
Supervisor Lozoff. Any other seconds?
I'll second it.
Mr. Ferguson, Supervisor Griffith, Supervisor O'Brien, Supervisor Ward, Supervisor Clary, and Supervisor Rozelle. Is there any discussion? Supervisor Haff.
The audit report does not show wages, correct?
Correct.
Will we be getting a report today what the hazard pay has amounted to date? And I'd also like to know, since we're kind of locked out of the building, I don't have my 2020 budget with me. What has been budgeted for 2020 across the entire county for overtime?
Okay. We can get that info and share it a little bit later on, Supervisor Haff.
Thank you.
Don't have it right here at our fingertips, okay. Okay, any further discussion? Supervisor Griffith.
Will that be broken down by department, the wages?
I will see what we can do, and I was going to ask to reach out to the treasurer to get that for us. So if you want it broken down by departments.
We appreciate that.
Okay, I don't know if the treasurer can hear us or not, as we're on here now. Al, can you hear us?
Yeah, I can give you the gross number, but if you want it by department, it's something I'm gonna have to send out later.
It's okay with Supervisor Haff, Supervisor Griffith, does that work for you? It's okay with him as well. Any further discussion? All in favor, signal saying aye.
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 Opposed? Carried. Okay. And now we're at the supervisor's privilege of the floor.
No, we got one more.
Oh, one more, I'm sorry.
One more report.
I apologize.
2020 mortgage tax warrant to the Board of Supervisors of Washington County. Your Committee on Finance respectfully reports that the financial statement relative to mortgage tax receipts made by the County Clerk and County Treasurer of Washington County for the period ending March 31st, 2020, and filed in the Office of the Board of Supervisors of Washington County. It appears that the amount received ending March 31st, 2020, eligible to the various towns and villages was $522,538.04. $785.57. And after payment of all expenses, the county share to be distributed to the several tax districts amounts to $496,954.02. Your committee recommends adoption of this report and recommends that the chairman and the clerk of the board be authorized and directed to issue the proper warrant to the treasurer of Washington County for the distribution of said tax.
Do we have a motion to move that?
Motion.
Supervisor Shaw, do we have a second? Supervisor Ferguson, Supervisor Fedler, Supervisor Losaw, Supervisor Ward. Any discussion? Oh, Supervisor Campbell, Supervisor Haff, question? Discussion?
Yes, this mortgage tax payment comes out twice a year. If I remember correct, this is a September to March time period that we're being paid now. So that this would be pretty much pre-COVID effect. Is that true?
Yes, that's correct.
So the next
Did you want to
payment,
comment on that? Yep. Did you want to comment on that, Treasurer Al?
No, I'm shaking my head, yes, sorry.
Okay, that's okay.
so the next payment we get is gonna be April to October or thereabouts for the next 6 months. So that's when we're gonna see a great effect, correct?
Is that correct, Treasurer Al?
The next disbursement, I believe, is in November, so yes, that will have the impact of COVID in it.
Thank you.
Thank you. Any further discussion? All in favor, signal saying aye.
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 Aye. Any opposed? Carried. Okay. There is obviously no one here requesting supervisor's privilege of the floor. Unless somebody has someone there with them, we'll move on to the next item, which will be the introduction to resolutions. Now, before we start that, in about 5 minutes, Congresswoman Stefanik was going to jump on our committee meeting, and Tim's going to let us know as soon as she gets on. She was looking for about 15 minutes of time. She has to be off by 10:45, and then we'll go back to where we are in the agenda with the motions. So I need a motion to set aside the rules for resolution number 144 and 150.
Motion.
So moved.
So moved.
I have a motion from Kazi. I have a second by Supervisor Henke. Any other seconds? Supervisor Ward, Supervisor Wilson, Supervisor Ferguson. Okay. Any Supervisor Campbell? Any questions? Any discussion? We do that by roll call?
Mr. Hanky,
Yes.
Mrs. Fedler,
Yes.
Mr. Ferguson,
Yes.
Mr. Shaw,
Yes.
Mr. Hall,
Yes.
Mr. Losaw,
Yes.
Mr. Hicks,
Yes.
Mr. Ward,
Yes.
Mr. O'Brien,
Yes.
Mr. Haff,
Yes,
Mr. Campbell,
Yes.
Mr. Skelly,
Yes.
Mr. Hogan,
Yes.
Mr. Wilson,
Yes.
Mrs. Clary,
Yes.
Mr. Griffith,
Yes.
Mr. Rozell.
Yes.
Resolution is adopted, 4,260 yes.
Okay. When you're ready, we'll start with the resolution.
Resolution number 141 by Supervisors Ward, Hogan, Haff, Hicks, O'Brien, Clary, Rozell, titled to make appointments to the Washington County EMS Advisory Board.
You have a motion?
Make a
Mr.
motion
Ward,
moving forward.
do we have seconds?
I'll second it.
Supervisor Clary, Supervisor Fedler, Supervisor Henke, Supervisor O'Brien, Supervisor Campbell, Supervisor Ferguson, Supervisor Rozell. Is there any discussion? All in favor, signal saying aye.
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 Any opposed? Carried.
Resolution number 142 by Supervisors Shaw, O'Brien, Campbell, Hicks, Fedler, Skelly, Hogan, Clary, Rozell, Losell, Ward, title amend 2020 budget, county road funds for 2019 encumbrances.
Mr. Chairman, moving resolution number 142.
Moved by Supervisor Shaw. Do we have a second? Supervisor Fedler, Supervisor Losaw, Supervisor Skelly, Supervisor Rozell, Supervisor Campbell, Supervisor Ferguson. Any discussion? All in favor, signal by saying aye.
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 Anyone opposed? Carried.
Resolution number 143 by Supervisor Shaw, O'Brien, Campbell, Hicks, Fedler, Skelly, Hogan, Clary, Rozell, Losell, Ward, title supplemental mortgage tax disbursement.
Mr. Chairman, moving resolution 143.
We have it moved by Supervisor Shaw. Do we have seconds?
Second.
Supervisor Fedler, Supervisor Losaw, Supervisor Henke, Supervisor Clary, Supervisor Campbell, Supervisor Ward. Any discussion?
Ferguson.
Supervisor Ferguson, did you have a question or? No? Okay. No discussion? All in favor, signal say aye.
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 Opposed?
Aye.
That was a yes side. Carried.
Resolution number 144 by Supervisors Clary and Hall, titled Resolution of Support and Sincere Appreciation to Glens Falls Hospital and their dedicated employees, and endorsing their ongoing efforts to obtain federal and state reimbursement of costs bore in connection with the COVID-19 pandemic.
Chairman, I'd like to move resolution number 44, please.
Moved by Supervisor Clary. Do we have a second? Supervisor Wilson, Supervisor Ward, Supervisor Skelly, Supervisor Rozell, Supervisor Ferguson, Supervisor Campbell, Supervisor Griffith, Supervisor Henke. Any other seconds? Is there any discussion? Supervisor Hicks.
Yeah, just in the last resolve, we should make sure we spell the Congresswoman's name properly, that's all.
That has been corrected
Okay, thanks.
since the mailing, yes.
Thank you. Any further discussion? All in favor, signal saying aye.
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 Opposed? Carried.
Resolution number 145 by Supervisors Campbell, Half, Hicks, O'Brien, titled to modify operation of county parks for 2020 season.
Okay, you have a motion to accept?
Moving resolution 145.
That was, who was that? I'm sorry, I apologize. Dave? Oh, it's Brian, okay. Yep, didn't see his lips moving. Okay, second? Any seconds? Supervisor Henke? Any other seconds?
Yes.
Supervisor Fedler? Okay. Any discussion?
Just quickly, I will support these town supervisors in their efforts with their park individually. Just so that we know up in Putnam, my restrooms and stuff will be open, and we're going to maintain that, because what you end up with is people, unfortunately, kind of breaking into them to try to use the facility, and that's hard to, if you will, monitor and replace up here. And I see Congresswoman Stefanik's on the net, so I'm out. Thank you.
Okay, thank you. We will carry on the conversation. I've got you, Supervisor Skelly. We'll get you when we come back. Congresswoman, it's all yours.
Unmute, Elise.
Can you hear me now?
We can hear you now.
Yes, thank you.
Okay, thank you, everybody. I just jumped off the Warren County Board of Supervisors call, so thank you for your patience. I want to first thank Washington County. It has been tremendous to work with the county officials as well as the local elected town supervisors. Everyone has just risen to the occasion, and it's been a true team effort. I wanted to provide an update from Washington. We are voting today. Unfortunately, the package that's being brought to the floor was not negotiated with the Senate or the White House, and it was not negotiated on a bipartisan basis. So this will not be the final legislative package. My focus is on making sure that we have a bipartisan legislative package that provides direct funding, not only to the state, but directly to the counties. And here's why I think that's important. I don't want to see Albany to be able to take that money from the counties back to the state, because we know the counties have borne the brunt of this crisis and are facing significant financial and economic challenges. The entire New York delegation has been working on this issue to ensure that no matter how rural a county or municipality is, that you're eligible for that direct federal funds. Previously, the legislative packages have required a population cutoff. So you had to be over 500,000 people in either a county, a city to qualify. That's a non-starter for the part of New York State and certainly for all of my district. So we want to make sure that even rural regions get the direct relief that you need. I also wanted to add, we are working with Glens Falls Hospital. While I know that's in Warren County, it obviously serves the constituents of Washington County. And with the rural pot of federal funds that was announced, Glens Falls, because of their unique geographic location and the criteria behind that, did not qualify. I had a call this week with the Glens Falls Hospital CEO, as well as the Deputy Secretary of Health and Human Services. So we are working on this on a cabinet level to make sure that we can provide some form of federal relief. We know that's critical. Given the unique challenges that Glens Falls face, whether it's serving positive COVID transfer patients, whether it's the challenges they've had because they've had to pause elective surgery because of the affiliation with the Capital District region, and they're a little bit behind being able to open up those elective surgeries compared to other hospitals in my district. So we are working on updating that, the way that is calculated, so that Glens Falls is able to get direct federal funds. In addition, we continue to provide direct federal funds to our higher ed institutions, which are really important. But as I've had conversations with our school superintendents, with teachers, with our law enforcement, those direct funds are needed both to the state and localities because of the just unprecedented nature of this. So we will continue to stay in close contact. I will continue to work with the Washington County COVID Task Force. But thank you everyone for the opportunity to participate today. I'm happy to answer any questions.
Any questions for the Congresswoman? I'll ask again, just in case I missed somebody. Any questions? Congresswoman, I think you're all set to head to your next meeting.
Thank you so much, Chairman Hall.
Thank you very much. We appreciate everything you're doing for us.
We're available 24/7. Don't hesitate to reach out. Sam knows, everybody knows they can call, text me anytime. We are processing casework every day of the week, and my entire staff is teleworking.
Very good. Thank you, Congresswoman. We appreciate it. We now will move to Assemblyman Steck.
Hey,
Yes, Assemblyman, you're live.
I'm live. Hey, good morning, everybody. Thanks for having me on today. I hope everyone's well. I'd like to follow up with what our Congresswoman said by just thanking everybody that's been doing the work. These last 2 months have been really rough on certainly all of our constituents, but also, you know, it's been a meat grinder for local government, and you guys have been great. You know, I've been paying close attention, talk to a lot of you. You're answering the calls. You're getting people help. That's the best thing that we can do right now. You know, as you can imagine, early on, the two types of calls my office was fielding was, am I or am I not an essential business? And then, of course, a lot of unemployment calls. I think it's migrated recently where it's mostly unemployment calls right now. You know, the Department of Labor is just frankly overwhelmed. They've hired more people, but this is not an easy thing that you can just pull anyone off the street to data collect. There's a certain amount of training and experience that comes with being able to do these Department of Labor inquiries correctly. So they're just overwhelmed, but that doesn't mean we should give up or stop. I've told other people I want to share it with the board here. And I know that Carrie and Senator Little's office feel the same way. Call our, you know, people that are having problems with unemployment, call our offices or send our offices email. We will do what we can to try to nudge DOL along. But again, I mean, they're still overwhelmed. but I'd rather have, 2 fishing lines in the water than one. So, if anyone's at a wit's end, and the calls that we're starting to get now are getting more and more desperate because they're getting, they've been without for a longer period of time. But, I want to applaud Washington County for everything that you've done to try to make sure that your numbers, you're meeting the metrics that you can control, so that you're ready to reopen. I had a conversation with a few of you, including Chairman Hall, last week. Senator Little and I put together a letter to the governor to ask him to consider Warren and Washington County as a sub-region of the capital region. I never saw a realistic chance that he was going to move us into the North Country. And frankly, and don't be frustrated with them for this, but I don't think the North Country was in a hurry to accept your numbers. I think that the North Country, looking at your numbers, a lot of the ways that Warren and Washington County look at Albany County and the way that Albany County looks at Westchester County, so that kind of thing. But I don't think the governor was ever going to reinvent the wheel. He had 10 regions that were already established 8 years ago with infrastructure in place to use. Rather than reinvent the wheel, he decided to use those. So I understand where he's coming from, but I think it was important for us to point out that even within a region, at some point, it's going to make sense to look more granularly that maybe Warren and Washington County don't necessarily need to be held up for the rest of the region. And now, as you look at the map of New York State and the other regions that are open, it's literally all that's left that hasn't met the criteria is Western New York, and then the capital region and down the Hudson Valley all the way to Long Island. So maybe at some point he might get a little more granular. I just think it was important to put that marker out there to make sure that that's on his radar. And I appreciate you guys doing everything that you can, and your partnership with Warren County and Glens Falls Hospital on the testing, I think, has been tremendous. As the Congresswoman said, my office too, 24/7. You guys know how to get a hold of me. Most of you should have my cell phone number. And certainly our office, and we are bird dogging issues as fast as they come in. I think this is the busiest as far as constituent service that we've ever been in my 8 years. But thanks for the work you're doing, and don't be shy about reaching out for help. And I'm going to stay on the call for as long as I can today. Thanks.
Thank you, Assemblyman. We appreciate that. Yeah, Supervisor Haff, question.
Dan, I appreciate your efforts, and Lise and Carrie, to try to get us a sub-region out of the capital district economic region. But I have a concern that we look a bit like hypocrites while we are maintaining a county state of emergency, saying that we want to be a sub-region so we can reopen. Can you comment on that?
Well, sure. I mean, I don't think we're ever going to be back to normal, Dana. I mean, you can still be in a state of emergency and have a functioning economy. I mean, when you have other states of emergency, we don't lock everyone in their homes and shut down. You've got a very real problem coming with poverty and revenues. If you don't have the revenues, you can't provide the services. We can't print money in New York State. I don't want us to print money in New York State. I'm not sure that we want to bet on the federal government riding to our rescue. They're broke too. So the solution to a lot of these problems is we need to reestablish a revenue stream. There's poverty kills as well. So, I mean, whether it's phase 1 or phase 2, the state is still in a state of emergency, and yet other parts of the state are reopening. So I don't see those as being inconsistent with each other at all.
Thank you.
Yep. Thanks, Dana. Good to see you.
Yes, Treasurer Dolette.
Assemblyman Steck, first of all, thanks for all your hard work. I really appreciate it.
You're
One
welcome.
of the things that the county obviously is concerned about right now is the possible state aid reductions coming our way because of the budget shortfalls.
Yeah.
But specifically, what I'd like to ask you about today, if you know any information about our CHIPS funding, because we're in that time of the season where a lot of the towns are planning their paving and they don't want to schedule their whole award if it's going to be cut by 20, 30, 40%, and then be on the bag for the lack of funding.
Yep. I see Brian Campbell's on the call. Brian asked me about this over a week ago, and we reached out and we were told at the time, yes, we know that we're in that normal window where the CHIPS number should be announced and be firm by now. And this was more than a week ago, Brian, right? And they said, I told Brian that I was told any day now. And as of today, I haven't heard anything more on CHIPS. Now, with that said, I mean, I think it's part of a larger issue, and the governor said that today would be the day that he would announce, or his budget director would announce the cuts to the budget and the aid for schools and our community colleges, and certainly I think other municipalities. So I would suspect that this CHIPS number may be rolled into a larger announcement coming today. And for those of you that might not remember, when we passed the budget in early April, the budget provided these windows for the budget director to go in and make these cuts. And the legislature has the opportunity to go back within 10 days to not vote yes or no on the budget, on the changes from the governor, but to submit our own plan and substitute. I do not see that happening. I'll be absolutely floored if we go back to override anything that the governor and his budget office announces here today. So what were the schools told? They were told to expect 20 to 50% cut in state aid. So to go back to Dana's question earlier, I mean, the phone's going to start ringing off the hook, and we've gotten some people saying, well, you know, why are you pushing to reopen? We need to be safe. We need to stay locked up. These same people are going to start calling saying, why did you cut all these benefits? Why all these programs that the state funds that are helping people through these tough times? Why are you gutting them? Because the state is broke. So, you know, I stand by for, you know, a nasty announcement from the second floor today on these numbers. But I don't, specifically to CHIPS, I'm sorry, I still don't have a number or an update.
And do you mind if I follow up, because there is an important federal piece to this? So to date, the federal government has provided New York State directly with over $9 billion. It was $7.5 billion in the CARES Act, and then there was a $10 billion pot, which New York qualified for $1 billion. So by far the state that garnered the highest number of direct support for hard hit spots, hard hit states impacted by COVID. So we have sent $9 billion to the state. And again, I am committed to working to deliver additional funds to not only the state, but the counties. And what's really important here is making sure that there's accountability at the state level to ensure that this funding goes to education, that it goes to our law enforcement, that it goes to emergency services, all of these critical tools that we do not want to see cut. And making sure that there are guardrails on the federal legislation is going to be really important. So you have accountability in Albany, and it cannot be moved around for slush fund priorities, but actually goes to these important services, whether it's education, as I said, or law enforcement. Thank you.
Congresswoman?
Yes, go ahead.
If there is federal money that's released to help the counties weather this storm, just be aware that, with all due respect to the governor, I'm not entirely warm and fuzzy that if it flows through the state, it'll actually make it to me. So if those funds could actually be sent to the county direct, just keep that in mind for me, please.
Absolutely. This has been something that has come up in almost every single call I've had with the 12 counties across the district, just based upon the record of not getting that money out to the counties, whether it's the FMAP increase, for example, or it's with the workforce development funds that we had to fight to get delivered to the counties. We know that it needs to be as direct as possible because of the track record and the failure to do so before. So that's what we mean when we talk about guardrails, is direct funding to the counties, not having to flow through Albany.
Thank you.
Dan Stack?
Assemblyman Stack, this question's for you. From
Hey, Dan.
Supervisor O'Brien.
I'm ready.
I have a
Fire away.
question. We looked at the shortfall date included the income tax date. Was a lot of that shortfall based on the lack of income and income date being shifted into July?
Yeah, well, when he postponed, the state followed the federal government in postponing the income tax date, and yeah, that's lost revenue. And you know that postponing that submission date, that's going to cost us revenue as well. Absolutely. Is that your question, Dana? Or I mean, Dave?
Yeah, that's my question. But if income tax comes in on July 15th, is he going to go back and redistribute those funds?
He's got windows where he could go back in and do that. I mean, how much is that going to be? Is the income tax going to be? I don't know. I don't think that the income tax is going to. I mean, really, this is sales taxes, everything else that we're gaining on. It looks like Brian wants to jump in here. Brian.
Well, I just was going to a different question because I had a Warren County person ask me about the money for the hospitals did that just recently come out of our sales tax? Because they had a belief that it did. And I don't know that that's out already, but I know I've discussed with Al and a few of the others how we're down so quickly, so much. And if that's out, that would kind of be a little more understandable.
The timing of, in the budget, there was a provision in there to fund hospitals by taking a percentage, and I can't remember off the top of my head what it was anymore, percentage of sales tax from the counties for the hospitals. I don't know if that's occurred or not yet, Brian. And frankly, I mean, as far as the magnitude, I think that's probably also a small chunk compared to just the big picture of the lack of economic activity that generates sales tax for both the counties and the state. So I think mostly the issue is there's no sales tax coming in at all. But I don't know whether or not the state has grabbed that money for hospitals or not out of your sales tax yet. But it is in the budget.
Okay. Thank you.
Yep. Dave, anything else, Dave? Okay.
Any other questions? Okay, the Southern Stack, thank you very much. We appreciate it.
You're welcome.
Okay, and now we'll go back to the resolution number 145 discussion, and we'll start with Supervisor Skelly.
Yeah, in the committee meeting the other day, we said like Lauderdale, we weren't going to man it, but it would still be open so that they had access to the facility to walk around. There was discussion on the beach whether we were going to fence it off or whether we were just going to put up signs, swim at your own risk, no lifeguards. I wasn't sure we decided which was which, and I wonder from Roger what the liability is either way, whether there's a fence or signs to the county. I don't know.
Well, I heard some discussion that the state was going to go to a swim at your own risk policy. I haven't seen any of the guidance the state's issued on that yet to their folks. We're holding that out as a swimming beach, and I'm really concerned that, you know, operating a beach is more than lifeguards. There has to be water testing all the time, at least once a day or once a week. Then there's other steps that have to be made available there. So my understanding was the way this reads now is we're going to fence off the beach. I would be okay with swim at your own risk if I saw something more about it and we were able to talk to NYMER, which we haven't been able to do either. But for now, the resolution reads we're fencing it off. And obviously with my life and my tolerance for risk, which is not very high because I'm not paid to make those decisions, fencing it off would be the best way to go. I'd also like to close the gates at night, parenthetically, just because, you know, that keeps people out from doing things like Mr. Wilson was talking about where, you know, folks are in there after dark with no observation. But right now, the way it reads is we're fencing off the beaches. If you want to change that, you know, we will assume additional liability if we do that. But if you're comfortable with that level of risk, then that's your decision to make.
Supervisor Happ.
I know we keep talking about fencing off the beach, but what actually does that mean? The beach is not the risk, it's the water. Why can't you fence off the water and allow people to still use the beach? You know, move the fence down within 3 feet of the water's edge. There is no high and low tide in Lake George, so it's not going to fluctuate. Couldn't that be done so that people can still enjoy the sand on the beach?
Sure, where you place the fence is not relevant. You're correct. We're worried about people getting into the water. So you can put the fence wherever you want to put the fence. And it's just going to be a strip of, to my understanding, a strip of snow fence. It's not like it's going to be an impenetrable barrier that nobody can get through.
Supervisor Rozelle.
I think it's too early to modify the operations until we find out what the state does. They're taking away, I know there's talk about saving $90,000. They're taking away from the kids being able to go there and have hot dogs and all this if we close everything down without supervision. Maybe we could do skeleton crews or something, but I believe it's too early for resolution 145, and there will definitely be vandalism. So that figure of 90,000 is going to be cut down some also.
Supervisor Ferguson.
Yeah, I don't agree with this. I think we're way premature on this. It would be crazy to shut the beaches down now. I mean, it's gonna be 80 degrees today. This could be lifted and we're gonna have a lot of people very upset that they can't just go to the beach and have their free day. With that tax dollars that have already been put there to have the beaches open.
Supervisor Shaw.
Yes, Mr. Chairman, Matt Jones, when he recommended or proposed this, wasn't there an issue about whether if you didn't call in the people, the part-timers, that they would have, we'd miss the opportunity of having them later? Was there some discussion on that? That time, and I have other questions, but I just was wondering if that was an issue.
Well, there's always a concern because you have to staff.
Right.
So you're not trying to hire the day before. Obviously, it's easier to get people lined up ahead of time than it is to call somebody and say, do you have a job yet? With the situation we're in, you might find more of those people than you might ordinarily find. But I know, for example, my daughter lifeguarded at a couple places, and she was, by spring break, the college spring break, which would have been in March, she had her job lined up for the summer in that respect, and most other places were lining those up too. So I think Matt's concern is if we're gonna go, we gotta have the people available to do that. If we're not fully open the beach, in other words, if we're not gonna go, that's fine, but it's gonna be hard for you to switch gears.
Right, so the point is, do we have the staff to go? And if we wait too, I mean, how sensitive, time sensitive is this resolution?
Chris, you want to join in on this, please?
Yeah, so, Mr. Shaw, I just want to clarify one thing in your statement. In fairness to Matt, I understand this is a very unpopular proposition. It was not Matt who made it. It was.
No, but there was a
I
time.
just want to clarify to save Matt, because it was not him. He disagreed with that recommendation. It was me who made the recommendation. Yes, he had concerns about staffing, and that was why we brought it forward now. The concern being that with the extension last night of the banning of all non-essential social gatherings of any size through June 13th, or no, was that one May 30th? I forget. It was extended several weeks. But anyway, it would be difficult for us to enforce that at the parks, and if we closed the parks until such time as the governor rescinded the executive orders, basically suspending New York on pause, there was concern that if it was in July, let's say, or late June, to Roger's point, we wouldn't be able to get staff because our staff might have gone elsewhere. To your last point, it's my understanding that Matt does have staff lined up right now that we're already kind of in negotiations with prior to this whole thing starting. So I don't know that we know that they're still available, but I think he was in really good shape for staffing the parks this summer at the beginning of all this in mid-March. And that was the reason that we brought the issue forward. What seemed a little bit early, it was trying to get direction from the board so that we could move forward with the staffing.
Do we have an appetite to table this until the June meeting where we may have a little more information to do this? Is that, do we have an appetite for a motion on that?
I would move that.
I second it.
I second.
Again.
Okay, who moved it? I apologize. Who made the motion? Supervisor Skelly made the motion. Okay, seconds?
Wilson.
Yeah, Supervisor Griffith, Supervisor Ward, Supervisor Wilson, Supervisor Fedler, Supervisor Rozelle, Supervisor Campbell. Okay, any discussion on tabling this? Supervisor Hack.
No discussion on motion.
So what does that mean? You're gonna try to staff it until we discuss it again? Or will the parks remain not staffed? I don't want to say the word closed because everyone says the parks are closed. No, the gates are open. You can go in. So what does this mean will happen until our next meeting? What is the status quo here?
Chris is going to comment on that.
So in the absence of this resolution being adopted, it would be operations as normal for the parks. And Matt can chime in if I'm wrong, but I believe that that means we start weekend operations the weekend after Memorial Day or the weekend of Memorial Day. So that would be that we would be bringing staff in and just opening for the weekends. I think we open weekends from Memorial Day through July 4th, and then July 4th, we go to the 7-day a week, 7-day a week operation.
Okay, if you do that, it's a fait accompli, because if we open the parks staffed now, there's no way in heck you're gonna then close them once they are open. $90,000 savings is significant. We're talking about reduction in chips and funding and everything else, but as soon as we come to the parks, we put a different hat on and we completely ignore the financial crisis we have. I would be against tabling this.
Supervisor Campbell.
What, I think there's a couple issues here. I don't think we have to go that far, Dana. I think we could actually just go with the swim at your own risk. And that would actually accomplish what we're talking, also saving the money, and they're allowed to use the parks. My bigger concern with the snow fence was the person that can jump in the water is agile and can get there, but if something goes wrong, the person that could get there to save them can't get through the snow fence. I'd rather it was a rope and they could take the rope and throw it to them.
You can move a snow fence so easy, Brian.
Just a different way of looking at things.
Point
But
of order, I don't
we
think,
should, I think it should go back to committee before we do anything else.
Right, yeah.
don't we have a motion to table on the floor?
Yeah, there's no discussion required. Or allowed. You're right. I crossed the boundary by giving everybody an opportunity to speak, and I apologize for that.
Who made the motion to table? Who made the motion to table?
Supervisor Skelly made the motion to table.
You shouldn't do that. You should allow discussion.
Vote no, and then we can discuss it.
Yes, vote no.
Then we can discuss it.
All right. Motion tabled on there. All in favor of tabling the discussion or tabling the resolution? Let's do a roll call on this, please, so I can, because I can't, it's hard to hear
Thank you.
everybody.
Roll call, please.
Mr. Hanky?
Yes.
Mrs. Sedler?
Yes.
Mr. Ferguson?
Yes.
Mr. Shaw?
Yes.
Mr. Hall?
Yes.
Mr. Lostock?
Yes.
Mr. Hicks?
No.
Mr. Ward?
Yes.
Mr. O'Brien?
Yes.
Mr. Hack?
No.
Mr. Campbell?
Yes.
Mr. Skelly?
Yes.
Mr. Hogan?
Yes.
Mr. Wilson?
Yes.
Mrs. Clary?
Yes.
Mr. Griffith?
No,
Mr. Rosell?
Yes.
The resolution is adopted, 3,376 yes, 884 no. The motion to table.
Thank you. Now on resolution number 146.
Resolution number 146 by Supervisors Shaw, O'Brien, Campbell, Hicks, Fedler, Skelly, Hogan, Clary, Roselle, Losaw, Ward, titled to authorize the treasurer to prepay contractual expenses for certain contracts with Glens Falls Hospital.
Mr. Chairman, moving resolution number 146.
Do we have a second? Mr. Wilson, Ms. Fedler, Mrs. Clary, Supervisor Ward, Supervisor Roselle, Supervisor Campbell, Supervisor Griffith, Supervisor Ferguson, Supervisor Losaw, Supervisor Hanky. Did I miss anyone? All in favor, signify by saying aye.
Aye.
Opposed? Carried.
Resolution number 147 by Supervisor Shaw, O'Brien, Campbell, Hicks, Fedler, Skelly, Hogan, Clary, Roselle, Losaw, Ward, titled to amend 2020 general fund budget to recognize CARES Act funding for Board of Elections.
Mr. Chairman, moving resolution 147.
Okay, do we have a second? Supervisor Fedler, Supervisor Hanky, Supervisor Roselle, Any other seconds? Supervisor Ferguson, Supervisor Clary. Okay. Discussion. All in favor, say aye.
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 Opposed? Carried.
Resolution number 148 by Supervisor Shaw, O'Brien, Campbell, Hicks, Feather, Skelly, Hogan, Clary, Roselle, Losal, Ward, title to amend 2020 general fund budget for interfund transfer to carpool fund.
Mr. Chairman, moving resolution number 148.
Do we have a second? Supervisor Wilson, Supervisor Ferguson, Supervisor Fedler, Supervisor Losaw, Supervisor Henke, Supervisor Campbell. Is there any discussion? All in favor, say aye.
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 Opposed? Carried.
Resolution number 149 by Supervisor Shaw, O'Brien, Campbell, Hicks, Fedler, Skelly, Hogan, Clary, Roselle, Losal, Ward, title to award contract for CR 46 pavement preservation project.
Mr. Chairman, moving resolution 149.
Do we have a second? Supervisor Fedler, Supervisor Skelly, Supervisor Campbell, Supervisor Roselle, Supervisor Losaw, Supervisor Ferguson, Supervisor Henke. Any discussion? All in favor, say aye.
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 Opposed? Carried.
Resolution number 150 by Supervisor Shaw, title to amend capital project 121, sewer district number 1, engineering and rehabilitation.
Mr. Chairman, moving resolution number 150, and I'd ask Chris to say why I'm sponsoring this by myself. It was overlooked in finance. Yes, it was overlooked in finance. Our apologies.
Okay. Do we have a second? Supervisor O'Brien, Supervisor Campbell, Supervisor Wilson, Supervisor Fedler. Any discussion? All in favor, say aye.
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 Anyone opposed?
Aye.
Carried.
There was no on that, right?
Right, you said aye.
Resolution number 151 by Supervisors Shaw, O'Brien, Campbell, Hicks, Fedler, Skelly, Hogan, Clary, Roselle, Losal, Ward, title to amend real property tax services 2020 budget to recognize additional countywide assessing grant monies.
Mr. Chairman, moving resolution 151.
We have a motion. Do we have seconds? Supervisor Henke, Supervisor Campbell, Supervisor Ward, Supervisor Losaw, Supervisor Ferguson, Supervisor Clary, did I see your hand up?
Yeah.
No? Yes? You did? Okay.
Yes.
Supervisor Roselle, did I see your hand up as well?
Yes.
Supervisor Fedler, okay. Any discussion? All in favor, say aye.
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 Opposed? Carried.
Resolution number 152 by Supervisor Shaw, O'Brien, Campbell, Hicks, Fedler, Skelly, Hogan, Clary, Roselle, Losal, Ward, title authorized placement of dispatcher on step for experience.
Mr. Chairman, moving resolution 152.
Do we have a second? Supervisor Campbell, Supervisor Ward, Supervisor Wilson, Supervisor Fedler, Supervisor Clary, Supervisor Henke, Supervisor O'Brien, Supervisor Roselle. Supervisor Ferguson. Any discussion? All in favor, say aye.
Aye.
Oh, I'm sorry, I apologize, got ahead of myself. Roll call.
Mr. Henke?
Yes.
Mrs. Fedler?
Yes.
Mr. Ferguson?
Yes.
Mr. Shaw?
Yes.
Mr. Hall?
Yes.
Mr. Losaw?
Yes.
Mr. Hicks?
Yes.
Mr. Ward?
Yes.
Mr. O'Brien?
Yes.
Mr. Hack?
Yes.
Mr. Campbell?
Yes.
Mr. Skelly?
Yes.
Mr. Hogan?
Yes.
Mr. Wilson?
Yes.
Mrs. Clary,
Yes.
Mr. Griffith,
Yes.
Mr. Rozell.
Yes.
Resolution is adopted, 4,260 yes. Resolution number 153 by Supervisor Shaw, O'Brien, Campbell, Hicks, Feather, Skelly, Hogan, Clary, Rochelle, Losaw, Ward. Title: Amend DPW staffing pattern for the summer construction season.
Mr. Chairman, moving resolution 153.
We have a motion. Do we have seconds? Supervisor Henke, Supervisor Fedler, Supervisor Campbell, Supervisor Ward, Supervisor Wilson, Supervisor Losaw, Supervisor Skelly, Supervisor Griffith. Any discussion? Supervisor Ferguson also seconded that. I apologize, Paul. Any discussion? All in favor, signal saying aye.
Aye.
Oh, it's a roll call too? All right. Got a bunch of roll. Yeah, I see that. I got the next one too. I apologize.
Mr. Hanky,
Reading ahead.
Yes.
Mrs. Fedler,
Yes.
Mr. Ferguson,
Yes.
Mr. Shaw,
Yes.
Mr. Hall,
Yes.
Mr. Losaw,
Yes.
Mr. Hicks,
Yes.
Mr. Ward,
Yes.
Mr. O'Brien,
Yes.
Mr. Haff,
Yes.
Mr. Campbell,
Yes.
Mr. Skelly,
Yes.
Mr. Hogan,
Yes.
Mr. Wilson,
Yes.
Clary,
Yes.
Mr. Griffith,
Yes.
Mr. Rozell.
Yes.
Resolution is adopted, 4,260 yes. Resolution number 154 by Supervisor Shaw, O'Brien, Campbell, Hicks, Feather, Skelly, Hogan, Clary, Rochelle, Losaw, Ward. Title: to amend resolution number 131 of 2020.
Mr. Chairman, moving resolution 154.
We have a motion. We have a second. Supervisor Henke, Supervisor Campbell, Supervisor Losaw, Supervisor Haff. Any other seconds I missed? Supervisor Rozell. Any discussion? Supervisor Haff.
This says this would take into effect Monday to stop the hazard pay during straight time. Why can't this be done today?
Chris, how does that work in the pay schedule?
It came out of committee as Monday, Mr. Haff. That's the reason it says Monday. It came out as Monday. I would recommend starting it at the beginning of a shift. So, that's why it was set to midnight. But there's no reason it can't. It would have to be amended. But the reason it was written the way it was is because the minutes of the committee meeting indicated it was supposed to start on Monday.
I'd like to amend this, that this takes effect noon today.
I'll second that.
Today?
Noon today?
Yes. We need to stop this as soon as possible.
Okay. So we vote on the amendment first?
Yes. Well, you need a second on the amendment.
Okay, we got a second. Supervisor Griffith, seconded it?
Yep.
Okay. Discussion on the amendment. Supervisor Clary.
I'm not on the amendment part, but I do feel like the public health nurses and that, what they're doing is over and above what they should be doing, but it's the time. So I worry about them not having hazard pay. It's something I just feel strongly about, but I don't know how to separate it from the other departments, or if it even can be. Something to think about.
Supervisor Fedler.
Is this something that Al can do to change payroll rates in the middle of the day?
Treasurer Noel.
So the short answer is it can be done. Actually, the departments will all have to go into their timesheets and manually move those hours, but it's a lot of manual work, but it can be done.
Who else? Did I see somebody else in the discussion of the amendment? Mr. Campbell. Supervisor Campbell?
I'd like to go back to Al. Yeah, I'd like to go back to Al and say, Al, what would you suggest? Because we don't need to make more work for people. Was it better on midnight or on Sunday, or was it better to move it back? Or is it better in a pay period even?
I'm not sure you want to wait a whole pay period if you're going to do it, but I wouldn't mind at least close a business today if you wanted a demarcation line.
Any further discussion?
The best business is better than at midnight?
Either way, it's a manual transfer, Mr. Campbell, so whatever you decide.
Supervisor Happ?
Okay.
We need to do triage. The patient is bleeding to death. Let's put the tourniquet on now, not Monday.
Supervisor Ward?
Yes, the 911 operators, we limited their outside employment. So in order, so they were out working EMS with the fire and the secondary jobs, that we didn't allow that. So if they came in contact with a infected person, they wouldn't bring it back to the dispatch area. And we've hurt their income, and I think that at least the 911 dispatchers should continue with their overtime rate, because they've lost their secondary employment, and I think financially some of them would be in trouble if they didn't continue to get hazardous pay.
Thanks, Supervisor Ward. Yes, Supervisor Happ?
Mr. Ward, these dispatchers are full-time employees. They've been paid time and a half for the last 2 months. So their secondary employment of a full-time employee, I don't think should be a concern of the county.
Well, when you stop their employment, it is a concern of the county because they aren't working because we don't allow them to do it.
They're a full-time worker of the county.
Yes, but their secondary employment, we forbid in order to protect the other workers in the center. So
Well, I don't
think it's fair that we restrict somebody and then don't compensate them for restrictions we placed upon them.
I agree. We should not restrict anybody what they do outside their full-time work. To me, that's unconstitutional. But the fact remains, they're a full-time employee. So we need to focus on their employment at the county, not their other employment. We don't fund their other employment. It's not our concern.
But we've taken income away from them, and fairness, I think it is a concern.
Well, who did that? Who? This task force? Who did that?
No, the task force didn't. I did it, Data. Under my responsibilities, we kick your head all you want, but under state of emergency, that's exactly what I did, was to protect the operation and say they were going to not have one person go out and be affected and come back and have the other members of the team quarantined so that our dispatcher operation in an emergency crisis couldn't function.
I don't think your
state
state of emergency does not bypass the Constitution of the United States. I don't care what the emergency is. Thank you.
Well, you have two constitutions you took an oath to. One is to the feds and one is to the state. So in between there is what we have to operate with. So, but you brought up triage. So let me talk about what triage has gone on here within our public health department, okay? They've been working 7 to 10 hour operational periods since March 1st of 2020. 18 public health employees and 4 additional RNs working per diem shifts are being rotated to a 7-day-a-week schedule. All non-clinical staff, including business, health education, and preschool special education staff, have been cross-trained in pandemic response, triage, documentation of isolation and quarantine follow-up, community resources and web-based resources and mental health supports. Clinical staff is always available for them for medical decision-making and general support. Assessment system, symptom triage, quarantine assessment and service of mandatory and precautionary quarantine documents, daily quarantine visits, are being made throughout the county by 2 to 3 clinical nurse staffing, spending 46-hour shifts, going to the homes for those under isolation for symptom checks, follow-up of basic needs and medicine and moral support. These routes are to follow the state dictates for public health isolation. Precautionary quarantine, daily calls, and mandatory isolation and quarantine calls required, in addition to home visits being made by clinical staff, a total of 2 assessment and decision-making support. Daily calls are now in excess of 150 per day and growing just for quantities. This does not include daily call volume related to COVID concerns, questions, advice from the businesses and the public. This is a rolling number as individuals are released and added daily. Each person has a backup for their specific task, and we developed 2 teams that rotate together so they have all the necessary skill sets each day for the 7th-day operational period. The public health staff has experienced responses in the pandemic responses. The line staff has put in a combined total of 772.25 additional hours above the expected during the time period. Normal expected hours of 5,635 actually hours worked of 6,407.2 hours. This is a combined equivalent of 100 additional days work over the time period, regardless if the 7-hour or 7.5-hour employee work schedule. 5% increase in time to a 25% increase in hours worked based on job duties and pandemic assignments. Signing up for and should just do their job. It's a time of public health crisis that we haven't had in over 100 years. It is truly unprecedented public health crisis. While they are well-trained and dedicated staff attacking this beast daily for months now, they have risen to the occasion, brought their unique skill sets, and rapidly developed new ones to meet the rapidly evolving dictates of this event, simply to try to keep people safe. Their education, training, and specialty skills have put them at the front of this response through no fault of their own, requiring more from them daily and some of their other employees. They have been here 7 days a week through the ebbs and flows of this outbreak, giving of themselves and their talents in a way that few who have been witnessed it will truly try to understand. To respond, remain at home with family is difficult to justify. We have not only asked staff to make sacrifices, but their families as well. Even if you disregard the unfairness of the situation, this does not make sense and unjustified relies on the dedication and good graces of a group of people who are fighting physical and mental fatigue and thus far above have avoided a complete burnout. The additional pay demonstrates to these professionals that they are valued not only for their skills and expertise, but also the tremendous time and effort required of them to respond to public health crisis that none of us have seen in their lifetime. So we talk about triage. We're talking about employees that came in that are working across the levels from what they were hired to do to make us safe in our communities. And I think that we need to take a serious look at how we address this. We are at the point in our county, at this point in time, where one size does not fit all. And I think when we have specific departments that go above and beyond, that are putting themselves and their family members, because that's what it extends to, if they pick up the virus, it goes home with the family, in danger, then we need to compensate them for that. That's called taking care of our people. And that's really simple. There are ways that if this is an issue with the dollars of it, there are things we can do. And I know this is unfavorable, but if I have to put a life ahead of paving a road, it would be a life. And so that's my comment on the triage aspect of it, Mr. Supervisor Haft, that you brought up. Yes, you have a question, comment?
Did you run for bidding secondary employment of the dispatchers through the county attorney?
We did.
And what did the county attorney say?
You said the employer can set the terms and conditions of employment. This is an at-will employment state. It was also run through the union as well.
All right, this is a good time for the treasurer to chime in on the cost that hazard pay has come, because I'm hearing you want to continue hazard pay for certain departments. No, everyone, now we're hearing, oh, don't close the beaches because we had some citizens push back. Do you have any idea the number of people that are pushing back in this hazard pay who dutifully paid their property taxes in January and now are out without work? Can they be reimbursed their property tax because the county is using it to pay hazard pay? And we're bleeding to death on this hazard pay. I estimate that we probably paid close to $750,000 on hazard pay.
Al, you want to touch on that?
612,487 as of Wednesday.
$612,000.
Yes, sir.
And what was the budgeted amount for time and a half for 2020?
1,553,450.
And we've yet to have the early fall snow for plowing. Wow.
Just a point of order, Mr. Chairman, we are discussing the amendment to change the effective date at this point. There's nothing on the table about who it applies to. We're just discussing the amendment at this point with the effective date. If you wanted to change who it applies to, that would be a separate amendment.
Supervisor Wilson?
Yeah, Al, are you on Kronos or are you WorkBrain or what system are you using, please?
We use Cronus for our time and attendance and New World for the actual pay.
Yeah, it's having personally done that, it's quite a little bit of work to do for a supervisor to go in, and it's one employee at a time. It's fairly painful. So if we want to I'm okay, kind of keeping it the way it's written right now, because you'll put people into the weekend doing this, just letting you know that.
Okay, so now on the amendment, Roger. So if we, is it appropriate to do the amendment to change the time before we know who's going to be involved?
Well,
or is that going to be afterwards?
All this does is change the effective date.
Okay.
So we would vote on this amendment to change the effective date.
Okay.
It would either pass or fail. The effective date would become effective. And then if somebody wanted to propose a resolution to exempt a department or departments, plural, from this change, we would add a sentence that says, say in the second to last whereas, the first whereas, or the second to last whereas, saying accepting whatever department you want to accept.
Okay.
Okay, so it would be effective for everybody. The change back to straight time would be effective at thus and such a time and thus and such a date for everybody. Then you could have another amendment that says except for.
Okay. All right. So is there any other further discussion? Yes, Supervisor Hicks.
Yeah, Dana, I'm in agreement with you that this should stop. I think it's a little bit harsh to do it in the middle of a day when people have already come to work. Al's suggestion of finishing at the end of the business day today, or I'm actually not even opposed to doing it at midnight on Sunday night, but it needs to come to an end. I think noon today is just a little bit much. If you would consider a compromise on your motion, maybe we can move forward, but I don't think I can do it at noon today when people have come in this morning and they're working through this afternoon and it changes right in midstream.
I could amend it for the end of business day today if Jim wanted to amend his second.
I'll amend the second.
Okay, is there any other further discussion?
Just to make sure the close of business today it's different for different people. So I would propose that it be, we're usually an 8:30 to 4:30 day. That's going to require splitting some shifts because, for example, the communications guys are on 12s, right, Tim?
Correct.
All right, so when's the end of shift for them? What are their three shift numbers?
6 p.m., 10 p.m., and then midnight.
Okay. For example, but we need to pick a time period at end, or do you want to say at the end of whatever shift they're in right now?
I like that one.
Al? Whatever shift they're in right now?
I like the close of, yeah. So anybody that came in under the existing resolution, the close of that shift, I think makes the most sense, and we can make that happen.
Okay, so we're gonna say, go ahead.
Yeah, so for like my payroll girl, it would be 4 o'clock today, but a dispatcher, it might be 8 o'clock tonight. You know what I mean? Depending on when they started their shift this morning. And
so at the end, at the end of the shift they're operating under now.
Yes, sir.
Okay.
And just for clarity, anybody who starts their shift after what time will not be included.
Well, see, that's
because I've got, we got deputies coming in at 2. We've got cleaners coming in at 4:30. We've got
midnight tonight.
Midnight.
Midnight tonight.
So anybody whose shift starts prior to midnight tonight will receive hazard pay through the close of their shift.
No, that's not what they're saying, I don't think.
That's why I'm trying
That's
to
a different
clarify.
concept. So I
I
like the
appreciate-
midnight because
I
you got to split
appreciate
your-
the discussion, everybody, but that's the point of what I came in to say. We've kind of set this resolution up to take effect Sunday night. We're gonna parse out. It's not clean. I recommend we stay with what we got. I mean, I'm happy to vote right now on the recommended resolution or amendment to the resolution, and then move forward from there.
Supervisor Campbell.
Yeah, that's kind of where I was going. Daryl's got it right. Not only that, it's a weekend anyway, and people are going to get time and a half on a weekend. So your savings between today and Monday are so minimal. Let's just stay with where we are.
When you say stay where we are, what does that mean, Supervisor Campbell?
I don't want to amend it. I just want to leave it the way it is.
Okay. Any other discussion? Supervisor Clary?
I think we should leave it the way it is because it's cleaner. But watching Chris's face when someone said about this, and when they have their payroll on weekends, does it stay at time and a half or does it go to double time?
It does not go to double time, and actually the employees who work on the weekend don't automatically receive overtime. So they could, given the circumstances of what their work week has been like, but it is not automatic that if an employee works on a Saturday or Sunday, they're being paid at time and a half.
Right.
Okay. So it does stay the same.
Yes.
Thank you.
The answer is it depends. The normal process, absent a contractual agreement, is over 40 is time and a half. So if you have a 35-hour-a-week employee that comes in and works on a weekend after working all week, they have 5 hours of straight time before they get to overtime. Okay? If your shift started on a Tuesday, so there's lots of different rules, but the rule the county uses is OT unless it's negotiated otherwise, overtime, and this is a state law, overtime after 40. And since a lot of our employees are 35s, they can work 5 extra hours of straight time before you have to pay them overtime.
Thank you.
Okay, is there any other discussion? Okay. All in favor of the amendment as stated? And can we read that one more time, Deb? Do you have it?
Well, I think we've got an amendment to the amendment.
The amendment?
The original motion was to amend it till noon today, and then it was further amended to the end of business today.
No, midnight.
Midnight. So midnight on today's 15th. So it would be effective at 12:01 on the 16th. Then is what you're saying.
Yes.
That was my understanding of where we were in the discussion. So that's what we'd be voting on, changing to May 18th, 2020 to May 16th, 2020.
Okay, so we have a motion? Can we withdraw the First Amendment? Was that what you did, Dana, when you switched your time?
Yes, and Jim also amended his second. So we do have a motion and a second for this to end at 12:01. 16th.
On the 16th?
Right.
All right.
That's what we're voting on.
So, okay, so we have the motion, we have a second. Is there any further discussion?
I guess it's
All in
technically,
favor?
it's not 12:01, it's 00:01.
Okay. Supervisor Henke?
I just wanted to point out, it's probably a fairly small point, but the DSS reimbursements are made on basis of the time and a half. So it's not the 600 number is not a complete number. There is a subtraction from that.
Thank you, Supervisor Henke. So Al, do we know what that number would be by any chance?
I can get it for you, Chairman.
Okay, just so we're working with the real number, that's all. because, we tried to keep it separate as to what was the halftime being paid above than what the regular time was. So we could monitor that. So I think we need that into the equation as well, when you get an opportunity to get it. Okay. All in favor, say aye.
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 Opposed? Myself.
No.
No, nay.
Who else? No. Daryl is no. I'm no. Cassie Feller's no. Lester Loso is no. John Rosella is no.
I'm
Dave
no.
O'Brien is no. Paul Ferguson is no. Don Ward is no.
Now we're in.
All right, let's go ahead and roll call it.
Mr. Hanky,
No.
Just to avoid confusion, a yes vote changes it to midnight tonight, a no vote leaves it as written.
Mrs. Fedler,
No.
Mr. Ferguson,
No.
Mr. Shaw,
No.
Mr. Hall,
No.
Mr. Losaw,
No.
Mr. Hicks,
Yes.
Mr. Ward,
No.
Mr. O'Brien,
No.
Mr. Half,
Yes.
Mr. Campbell,
No.
Mr. Skelly,
Yes.
Mr. Hogan,
No.
Mr. Wilson,
No.
Mrs. Clary,
No.
Mr. Griffith,
Yes.
Mr. Rozell.
No.
The motion is defeated, 1,164 yes, 3,096 no.
Now we're back to the resolution again.
Now we're back to the resolution again. Do we have is there anyone who's interested in amending it to exclude specific departments? Supervisor Filler?
I don't know if it's an amendment. I have a question. So
Sure.
if we're meeting every 2 weeks, possibly amend it, couldn't we amend it to still pay hazard pay for the public health nurses and the 911 centers since we took their other employment away and reevaluate it again in 2 weeks?
We can have a special meeting if the time comes that we need to address that. Yes, Supervisor Rozell.
If that's a motion, I'll second it.
Okay.
Is that a motion?
Yes.
And we have a second? Okay. And Supervisor, is it seconds or questions? We're in discussion.
A
Let's get
second.
seconds. Is there any other second to the motion?
A second.
Supervisor Clary, Supervisor Losaw, Supervisor Ward, Supervisor Ferguson. Okay. Any discussion? Supervisor Campbell.
So this was the discussion I tried to have the other day when we came up with this. And Mr. Steck has given us more grim news today, and so has Mr. Bonnet. I think where we have to come now is to where the email started before with, we can't just look at cost, we have to look at cost and effect, and we have to go back to fairness to all of our employees, our taxpayers, as fair as we can be. Not everything's gonna be fair going forward, folks. It's not possible. But we have to be fair as much as we can to the people paying the taxes and the people that are working for us. The more money that we put with one to the other causes more unfairness. Right now, we're asking a group of people to come back to work or start back to work over the next few weeks. And you're telling them that they're all gonna come back at regular time, where we keep paying time and a half for a group that have been paid that for 2 months. I don't know the actual answer. I just know we need to be fair to all our employees and to the taxpayers that have already paid their taxes to receive the certain goods and services that were expected. Right now, if we are looking at poverty at a degree that we've never seen, as Mr. Steck put it, which is, those were kind of harsh words to have to just listen to from your state assemblyman. We may want money in different areas than we've ever put money before. And we can't think that one certain group of people is any more special than any other group. And I look at this the whole way, even to the parks, the people that can afford to absolutely do nothing. If they can go for the park for free, that's a huge deal, especially if we can do it with no cost to us. I think we're getting there at this overall look, and I really appreciate that. But I think at this point, I'm a little bit leaning in Dana Half's direction that we can put all different ideas that this one will start this week and that week, whatever, but it probably does have to all stop now, because if we don't, we're going to be unfair to all these different groups and to each other. And I think the fairness has to begin now, and we stick with where we were. I just can't get myself there now to do certain groups differently as they're all coming back to work. If they're working extra hours, they'll get extra pay. We've done well by them. I think they're grateful and appreciate it, and they wouldn't want us to talk about them as if they were ungrateful, because I know they're not ungrateful. They're very grateful for what we've done. They appreciate everything we're doing for them. We need to continue all that we can do, but there's a limit. If we keep doing these sort of things, the things that we need to do later that will be even more important, we will not have money to do. I guess that's where my concern is.
Supervisor Hicks.
I have two questions. Number one, can I get a specific on the exact motion? What are we talking about here?
Excluding what?
Public health.
Public health
Dispatch.
and communication, public safety department communications officers from the effects of the overtime changing on Sunday night.
Indefinitely, or is there a time frame involved?
As of now, it would be indefinitely or until the chairman ended the state of emergency, whichever happens first.
We also discussed, Cassie, Supervisor Feller also brought up that we discuss this, revisit every 2 weeks.
Okay, let me ask you this. At some point, it's going to have to end, right? What's going to be the catalyst? What's the metric you're going to use to say, now it's time? Can you tell me that now? Or is it going to be one of those, well, it's a gut feeling, so now seems like a good time to do it? Let's make it tangible. Let's make it definitive, and tell me why, if we're not going to do it now, we are going to do it at a certain date.
I think it would be for the guidance of the emergency management team, the public health department, who is working on a day-to-day basis. They don't expect us to go on forever.
What's the metric? What's the metric? What's the catalyst that's going to change it?
Supervisor Henke.
How about the catalyst being when we open for phase one?
Which going to be at least a month. So this is again indefinite. We have no real reason to know how long this is going to last. Correct. So the bleeding Dana's talking about at $600,000 now could be $1 million next June, by June, and then we're just going to keep going until somebody else decides that it ends. It won't be our decision. It'll be somebody else's decision.
It's as soon as we hit the 7 metrics.
Yeah, that's somebody else's decision, not ours.
No, it is a timeline. I mean, it is a metric.
Yeah.
Any other comments? Supervisor Shaw.
Yeah, Mr. Chairman, maybe people are more current on this than myself, but I was told that Saratoga County opted into the overtime policy that we're using and then immediately opted out, and that Warren County never did. So is their public health getting time and a half hazard pay? I mean, are we the anomaly, or is the norm no overtime pay? I mean, we're struggling with this, and I see why we're struggling with it. Everybody makes great points, but where do we fall in the big picture with all the employees in the state as far as different counties?
I will say this, we are probably the anomaly, okay? But we don't have the responsibility for the safety and welfare of the public in other counties. We have it here in Washington County. That's our charge. Not Warren County, not Saratoga County. They have a board of supervisors that will make their decisions as to how they protect their people within their state. You know, we can go through this process, but there's going to be no guarantee that we have a public health department that's going to be able to respond. Those people are going to come to work. And then we have another situation, okay? So I think we need to look at this from all avenues and not just say it's a money issue for us. And that's, you know, we're not charged, Ian, to be Warren County. We're not charged to be in charge of Essex County. We're charged to represent and protect the people of Washington County. So what other counties do, they do what they do. They do a lot of things different than we do. So
we are the anomaly.
We are the anomaly.
Okay.
Yep.
But to clarify, this won't stop people if this resolution passes as it is now without any other amendments, if public health is working at the operational tempo they're working, in all likelihood, their employees will qualify for overtime under the New York State overtime rules.
Yep.
Which again, if you work more than 40 hours in a week, you're entitled to time and a half. So if we think this is going to stop time and a half completely, that will be unlikely unless you also impose a there shall be no overtime in these same departments, especially public health, because their operational tempo and the number of hours they're working.
And that is normal throughout the state in all counties. So that we're got a level board there. That has nothing to do with that.
Right. We can't change that. I still want people to say there will be no more overtime. It's like, yes, there will. There'll just be less of it in places like public health who are already working more than 40 hours a week when they're working their 6 on, 1 off schedule.
Right.
All right. Just wanted to keep
Roger,
that in
this is
mind.
hazard pay. We're talking hazard pay. We're not talking all the other overtime.
I understand that, but I heard the term overtime's been bandied about, so it's probably better talking about it as the hazard pay rather than just overtime, because there will still be an overtime budget to deal with this in terms of what public health has to do at a minimum.
Okay. Right.
Clary, you have your hand up?
Yes, the federal government is, Al, have you got the one letter that said they were not going to pay hazard time at the federal level for FEMA? But then didn't it go back on the table this week to work for it towards tier 4, the tier 4 funding? Is that a possibility?
You're gonna have to talk to Chris or the chairman, because I don't have anything since the email.
Chris can bring us up to date on that.
So yes, we received an email that was from DHSES at the state level last week, indicating that based on some spurious claims in my opinion, they weren't going to cover the hazard pay. We have elevated that through the Congresswoman's office, and her staff is trying to advocate on our behalf at FEMA directly and bypass the state for that particular item. I believe what Mrs. Clarity is referring to is that they started negotiations this week on round 4 of the COVID stimulus at the federal level. As the Congresswoman said, there is a House bill, but it was not negotiated with the Senate or with the President. So largely, I think the House is going to make a symbolic vote today on what the priorities of the Democrats in the majority there want. I don't think that's necessarily a useless exercise, because what it does is it just clearly outlines what their priorities for this 4th round of stimulus are. What's somewhat concerning is that the Senate Republicans at the federal level have come out and said that they would like to slow down and not pass the 4th round of stimulus immediately. They make some valid points that there's still money out there, and they want to see how things are coalescing and where the real needs are. And I think that's valid. I just hope that they don't put too long a pause on it, because if there is going to be any direct funding to the states and the local governments, that becomes very crucial for us as we plan on how we're going to operate for the rest of this year and moving forward. So some certainty on whether or not there will be federal funding directly to the counties and to the state and what that looks like is going to be very important for us. So yes, Mrs. Clary, they started negotiations on round 4. It looks like the House is going to pass something today or tomorrow, but it will not be enacted. It looks like it's DOA in the Senate based on what Leader McConnell has said. So more to come from the federal level.
One more,
Supervisor Hogan, I'm sorry. Go ahead.
one more question to Chris. Would that define that, would overtime be still defined as hazard pay? If that is reimbursed, would it have to be defined as hazard pay?
Yes.
So overtime wouldn't fit.
Well, overtime directly attributable to
So,
COVID.
correct. So like if we look at overtime expenses within public health, those are a slam dunk reimbursable through the FEMA COVID, because we can make a direct and unassailable argument that those are costs directly related to the county's response to the COVID pandemic. The issue at hand here is that we placed the hazard pay policy in effect on March 18th. The original determination was that because the federal disaster declaration was not made until March 20th, that fulfilled the FEMA guideline that we had the policy on the books before the federal declaration, and therefore it was eligible for reimbursement. The state, in my opinion, got creative and went back and said that, oh, well, the federal disaster declaration was made on March 20th, but they retroactively placed the event start date of January 20th. Now, the feds did that to be helpful in allowing municipalities to claim expenses going all the way back to January 20th, but the state used that as a technicality to say our policy had to be on the books prior to January 20th.
Thank you.
So Supervisor Hogan, did I see you have a question?
No, I didn't have a question, Mr. Chairman.
Okay, I apologize.
Okay.
Yes, Supervisor Skelly.
Yes, well, I agree that the public health has been doing an outstanding job, and I certainly want them to get paid for all their extra hours. At this point in time, you know, when we look through our taxpayers, there's a lot of them that are working as nurses, working in nursing homes where they're in direct contact with COVID patients, and I doubt that they're getting a hazard pay on top of their regular pay. So I think we got to keep everything even here in the whole system.
Treasurer Al.
So, real quick too, a couple of questions. The DSS adjusted number for the COVID hazard pay brings it to 551,440 after their state aid reimbursement. And the cost of the two departments that you're talking about is about 30,000 a pay period.
Okay. Dana, did you get, Supervisor Half, did you get that?
Yes.
You asked for it? Okay.
Thank you.
Yep. Okay, any further discussion? Supervisor Rozell.
Speaking on Brian's outlook on that, since March, the workers that are going to be coming back did not, they had to worry naturally, but not as much as the nurses had to worry. They weren't at risk. The highway workers weren't at risk half as much as the health. And I don't believe if we do it right, they'll be at risk in the next 2 weeks until the next meeting, as much as the public health. I realize it's really hitting the taxpayers, but we got to protect the people that work for us, and we got to protect the public the same way. That's my opinion.
Thank you, John. Yes, Brian. Supervisor Campbell.
I appreciate what John, I appreciate what you say, John, but do we think that throwing money at this issue protects people? Because I don't think the protection's any different, because this leaves us with less money to even buy PPE stuff. I mean, this will restrict us going forward on the things that we can do to help other people. And I think that's what scares me is we've been fair. They're grateful. I don't think they're going to be less grateful. I think they have an understanding that we do all have to get back to work, and we have to have money enough to pay them. And the last thing we want to do is cut. And if we can use our money effectively, we can take care of a lot more people, whether it be employers or employees or taxpayers. They all need taken care of. We've got to be fair on this. And I think we've done, I don't know if we've done enough. I don't know that we can do enough. We're all broke. I don't know where the reality is that you don't, that, I mean, I thought Dan Steck said it as well as it could be said. We're all broke. Don't look at it. It's almost like Roger said early on, and I commend Roger for the fine work he's done as our spokesperson. And it really struck home when he said to me, look at everybody as if they've got the infection, okay? This is the same thing. Look at all these groups that we think are gonna bail one another out as they're all broke. They've got nothing to bail each other out with and act accordingly. And how do we ration food so everyone eats? How do we ration money so everyone gets paid? How do we get back to normal if we don't start doing normal things? That's all I have.
Supervisor Griffith.
I just want to go on record. I completely support our medical supporters, our first responders, and the 911 operators. But we need to get back and tighten the belt and figure out what's going to happen. We have to start at a point, and today's that point. We're coming out of this. We've got a reopening committee. We're going to move forward in reopening our public to going out. We have to live with this virus, and we have to start at a point, and we have to control our expenses, and we got to do that right now. Thank you.
Thank you. Any other comments? Yes, Supervisor Loso.
Yes, I just want to say, Brian talks about fair, and a lot of people have talked about being fair, but I don't think it's going to matter. No matter which way you go, it's going to be unfair to somebody. You know, whether if we don't do it, we're going to be unfair to the public health. If we do it, we're not fair to the highway. So we're not going to win in the fairness category. The idea is we just don't have the money. There's other people out there that are dealing with the public, and so they're all at risk. You know, you're talking about the sheriff's deputies and the corrections officers and the probation department and all that. They're all in contact with them, so they're all going to be have that risk. So we can't be fair to everybody. So we just got to be fair to what the county is. Be fair to the county as a whole.
Thank you, Lester. Any other discussion?
Voting on the amendment.
Okay, so we're voting on the amendment. What is the amendment?
The amendment was to exempt public health and dispatch from, they would receive the hazard pay.
So
Now, was that gonna be reviewed every 2 weeks? Is that in the motion or not?
It was.
I believe it was.
Pardon?
It was.
It was. Is that what you said, Cassie?
No.
Yes.
Yes.
be reviewed every 2 weeks.
To be reviewed every 2 weeks.
Roll call on this?
Okay, yes. Please. Do a roll call, please.
Clarification on what a no and what a yes is.
All right, so a yes exempts the two departments, public health and communications, or amends the resolution to exempt the public health department and the communications officers and public safety from going back to straight time Monday, first thing Monday. A no vote leaves it exactly the same, and everybody would be going back to regular pay rules, regular overtime rules, no more hazard pay, effective Monday at noon, Monday at midnight. Remembering then, we're going to have to vote again on the resolution as it's written. So this just is the exemption. Either you want, if you want them to continue getting, those two departments to continue getting hazard pay when everybody else does not, and I'm sorry if that sounds like a loaded thing, but that's the essence of it, you vote yes. If you don't, if you want everybody to be treated the same come Sunday night into Monday, you vote no.
Whoa. If you don't want them treated the same.
If you want those two departments to continue receiving hazard pay after midnight, Sunday night into Monday, you vote yes. A no vote means that midnight on Sunday, they are treated just like everybody else, and they go back to regular overtime rules, and the hazard pay disappears. Any questions about that?
Okay. So all set.
Okay.
Mr. Hanky,
Yes.
Mr. Spedler,
Yes.
Mr. Ferguson,
Yes.
Mr. Shaw,
No.
Mr. Hall,
Yes.
Mr. Losaw,
No.
Mr. Hicks,
No.
Mr. Ward,
Yes.
Mr. O'Brien,
No.
Mr. Hack,
No.
Mr. Campbell,
No.
Mr. Skelly,
No.
Mr. Hogan,
No.
Mr. Wilson,
No.
Mrs. Clary,
Yes.
Mr. Griffith,
No.
Mr. Rozell,
Yes.
the amendment is defeated, 1,593 yes, 2,667 no.
So now we're voting on the regular, absent any further amendments. Would be voting on 154, which basically stays just the same as it was when we started, which means that the hazard pay rules would be lifted as of midnight, Sunday night into Monday, which is the original way it came out of committee.
We have a motion. We have a second.
Roll this one too.
Yeah, we're gonna roll this one also, so we have the,
Further discussion.
yeah, for further discussion on it, we are now. Any discussion? Seeing or hearing no discussion, we'll go ahead and take the roll call vote, please.
Mr. Hanky,
Yes.
Mr. Spedler,
Yes.
Mr. Ferguson,
Yes.
Mr. Shaw,
Yes.
Mr. Hall,
No.
Mr. Losaw, Mr. Losaw,
Yes.
Mr. Hicks,
Yes.
Mr. Ward,
Yes.
Mr. O'Brien,
Yes.
Mr. Hack,
Yes.
Mr. Campbell,
Yes.
Mr. Skelly,
Yes.
Mr. Hogan,
Yes.
Mr. Wilson,
Yes.
Mrs. Clary,
Yes.
Mr. Griffith,
Yes.
Mr. Rozell.
Yes.
The resolution is adopted, 3,987 yes, 273 no. Resolution number 155 by Supervisors Campbell, Rozell, Hack, Hicks, O'Brien, Ferguson, Losaw, titled to adopt countywide mask policy.
Do we have a motion? Mr. Campbell?
Yes, so moved.
Okay, do we have a second? Mr. Wilson, Mr. Ferguson,
Second.
Mr. Hanky, Mr. Losaw, Mr. Rozell, Mr. Griffith, Mrs. Clary. Any other seconds? Mrs. Cassie, Ms. Sundler. Is there any discussion? Mr. Shaw?
Yep, I'm a little confused. What is the need of this policy? Isn't it the state has this policy already?
Chris?
State has an executive order that requires face mask use in public. The thought behind this policy is that as we bring employees back, we as the employer have to take certain steps to keep the public and our workforce safe and compliant. And as the private businesses are being asked to put together plans that will be submitted to the regional control center, this is essentially one component of our plan to move forward with bringing back the employees. So this is a codification of what we are expecting of our employees with regard to the appropriate use of face masks and compliance with the state and federal guidelines. Okay, thank you.
Supervisor Haft.
Question for Chris. Chris, this is redundant of a state policy. Is the reason the county doing it so that the county can enforce it upon the employee? Is that the reason why? Because I don't see any reason for this. I don't quite understand the reason.
I would say it's twofold. One is edification, so that we have it in writing, it is clear. And then yes, it would also provide us the mechanism to enforce the proper use of masks among employees.
All right, thank you.
Supervisor Shaw.
Yeah, I don't know if anyone here can answer the question. How many days can you wear a mask without washing it? They're supposed to be able to be washed 15 times, but I was under the impression, I asked one healthcare professional and they said that only 1 day, and then you're supposed to wash it. If that's the case, then are we making sure everybody's gonna wash these every night?
Tim may be able to.
Otherwise, you could be carrying, World Health Organization, CDC, and I showed you that little tag from the Surgeon General. It said if you don't do it properly, it's worse to wear a mask than not to wear a mask. And I know I generalize that, but the point is, if you're not washing them and taking care of them.
Correct.
I just hate to get into a policy maybe we shouldn't be getting into.
The care of the mask is important. You're supposed to wash it daily to make sure there's no contaminants on it that are going to harm you.
So it's worse to wear an unwashed mask than to wear no mask at all, basically. I know I'm summarizing it, but because you're carrying yesterday's contacts with you today and into tomorrow.
There's a potential for it, yeah. That's why the guidance says wash it daily.
Thank you. Yes, Supervisor Griffith.
I apologize, Supervisor Shaw, but are we watching to make sure everybody washes their hands after they use the restroom? I don't understand the point about washing the masks. I apologize, Supervisor Shaw.
Any other comments? Questions? Discussion? All in favor, signal saying aye.
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 Opposed?
No.
Carried. Okay. I think that takes care of the resolutions. And now that moves us over to the supervisor's comments. I have one thing I'd like to start off with. The Veterans Home that handles quite a few areas down in Saratoga County as well as here in our area is having a food drive on May 25th at the Fairbend Malls. And they're looking to see if we would be willing to allow our Veterans Agency to participate, which I don't believe will be an issue. The issue that came up when I discussed it with Roger was the use of our logo so they could list under things at Washington County Veterans Service Agency with our logo for the county was on there as a supporting this. And so I kind of want to get a consensus before we just went ahead and told them to do that, because I know there was a time in the past when there was some controversy over that. Supervisor Griffith?
The date's May 23rd. It's going to be at Aviation Mall. We are coordinating with both the the Veterans Housing, Community Housing Coalition, as well as Warren County has also accepted. So there'll be multiple organizations with this, and we're including a mask handout as well.
Okay, thank you. And they are challenging, the Warren County Board of Supervisors is challenging their supervisors to distribute food, to donate food. If you'd like to do that, we can coordinate something here to have it maybe dropped off outside, and we can get up there all at one time or whatever the case may be. Supervisor Haft.
To the mask, the employer is supposed to provide masks to the employee. I don't know how many. In town of Hartford, we gave an allotment to 2 masks to every employee. hardly anybody took us up on the offer. I think they have their own mask, which is fine. But the employer, I think, has to provide all of our employees masks. Another point, getting outside, breathing fresh air is a very good thing for everyone's immune system. And I'm glad to see that Al Nolet is in the heart of the county, breathing fresh air on my property. Thank you, Al.
Yes, Supervisor Hicks.
Okay, not to beat a dead horse, but we didn't really get any discussion regarding the parks. So it appears that they're going to open on Memorial Day weekend and be open till at least middle of June. So I assume that we're going to see some kind of policy regarding training for the staff, whether they're required to wear masks and when they have to be required to wear masks. Are they going to have the people who visit the parks? Are they going to be required to wear masks? And if they don't, will we have our park staff be enforcement agencies now to tell them that they have to or they have to leave? Is there going to be a training mechanism for all that staff between now and then? Are we providing PPE to all the staff that are working on those? And are we having them or the buildings and grounds sanitize the restrooms and the other public facilities at both parks daily or more than daily? I don't know. I'm sure no one has the answers, but I assume I'll be seeing some kind of policy in that regard between now and Labor Day weekend. Just looking forward to it.
Yep. Point well taken, Supervisor Hicks. Supervisor Griffith.
I agree with Supervisor Hicks. There was some pieces to that. Beaches will be at 50% capacity. Masks will be required when social distancing not possible. So more to what the state is putting out. I'd like to see us, dive into what they're doing and see if we can, facilitate that at our level.
Really, Jim, dive in. Jim, really dive in. Come on.
The swim mask doesn't count as protection, right? Supervisor Henke.
Just a couple of things. I think that if you are not looking at the state's website on this, it's Forward New York, forward.ny.gov stats with a bunch of the state regulations with the guidelines and things. You really ought to take a look at that. It's a pretty good resource for us, and a lot of the problems we're solving have actually been solved. I've been rather pleasantly surprised dealing with the people on the reopening team. They seem to be pretty responsive and pretty quick to get back to me and things. We are still, essentially closed here for two metrics. One of them we were doing very well, and then we had 17 hospitalizations. That goes back to being in the Capital District region. 14 of them were out of nursing homes in Albany County. So, it's frustrating from that standpoint, but we are making progress, and we are very close to phase one. So we ought to be thinking about that, pretty strongly, how we're going to do it.
Thank you. And you have a meeting scheduled with your committee on, I think it's Tuesday at 1 o'clock?
That's accurate. Tuesday, 1 o'clock.
Okay. Thank you, Bob. Supervisor Campbell.
A couple things. First of all, I think the committee should probably meet to discuss the parks before they open. I think that should go back to committee and get that all ironed out as to where they want to go before we ever open the park, no matter when the date is. I think that would be a good idea. The other thing is, when it comes to a mask, remember, you're wearing a mask out of respect for other people and not trying to contaminate them. It's not really helping you. And if you wear the thing dirty, you're really not helping you. So that's kind of the bottom line there.
Thank you, Supervisor Campbell. Supervisor Wilson.
I just want to thank everybody for a very lengthy and quite candidly healthy discussion about the pay, the tension between safety, recognizing people's values or value, contribution to what we're doing, and that sort of thing. So I don't want to say that anyone didn't have any good ideas. It was all well said, and I appreciate everybody's discussions there. And then the final thing is I'll need a little help. I've got 2 open seats. I don't know if you all know, I lost a town council member last week. died of an apparent heart attack at the house. And so we have an open seat, but we also have another open seat vacated the election. So we'll have a lot of our town council up for election here this fall. Thank you.
Daryl. Supervisor O'Brien?
So I wanted to give you some information on the Regional Planning Board. We know that a lot of businesses are having a hard time. The Regional Planning Board has established a COVID loan fund for fast tracking for companies that need some help get over the cash flow. Some of the companies were successful with small business, but others are left out of it. But as importantly, we were just invited to apply for up to a $3 million loan or a grant to provide for COVID resilience in the county. So hopefully we apply for that. We should have that in an answer in about 30 days, whether we're awarded that money or not. But that would be a significant help to a lot of the business in Washington County. That funding is coming from the federal government, the Economic Development Agency, which we are a representative in New York State to run that for the Regional Planning Board in the 5-county region. But I just want to let you know that there is some help coming out there for businesses that we can tap into. We hope to be able to, in this loan program, perhaps be able to extend that to some agricultural industry. And some of our other loan programs didn't provide for that before, but we think within what we're doing, we're going to try and include agriculture also, because a lot of the farms really need a boost. I mean, they were finally, before this happened, getting their hundredweight cost up. It was getting up to $17, $18, $19 in some cases. Now they're down with all the penalties and costs of COVID from the haulers. They're down to about $13.50 hundredweight, and that's put a severe problem with a lot of the farms today. And a couple of them have gone out of business because they just couldn't afford to run anymore in Washington County. So I just want to let that out. That's partially good news that there may be some help out for our businesses as they start to recover from the program.
Dave, I know you haven't, it's early in that process. How is that, do you have any idea how that's going to be administered as we speak? Is that going to be, administered? Any instructions on that yet?
No, we will be releasing that. What will happen is the Regional Planning Board will be the loan fund. They'll have their own policies and procedures in place. We have an established loan committee. They will meet as needed to fast track some of these loans. One of the things that is different about this fund or this money they're proposing to give us, or award to us, I should say, is that normally we would need a rejection from a bank. They have waived that for this COVID funding for this loan fund. So that will help us fast track it. Generally, to go through a bank to get a no is probably about a couple of weeks of time. But if we can eliminate that time and fast track the loan program, that would be good. But it will be sort of administered just like we've administered the other 4 loan funds we have already in place. But so we'll see what happens. It's not a guarantee, but they did reach out to invite us to apply for up to $2.9 million grant. So we hope it'll help. We will release more details as we get there.
Good. Thank you, Dave. Is there anything else to come here today? Any more comments? Supervisor Hogan.
Chairman Hall, I do want to formally recognize the passing of Justice Michael Keenan, who passed away last week after more than a decade as serving as town justice in the town of Kingsbury. Our condolences obviously go out to all his family members. The Keenan family is a very well-respected family in the community. We have been assigned with an interim justice in the meantime. Justice Mel Buccio has graciously accepted the role interim until we can get a new justice during the fall elections. But I just wanted to point that out to the board and the general public. Thank you.
Thank you, Supervisor Hogan. He was well respected in his field and did a great job for the residents of Washington County, and specifically the town of Kingsbury. So thank you for bringing that up. Is there anything else? Any other comments? I would just like to Supervisor Clary. You're on mute, Sue. There you go.
Thank you. Sheriff Murphy was in a virtual concert for the Charles Wood Theater. I don't know if all of you heard his Bruce, I think it was Bruce Springsteen song. It was absolutely fabulous. He did a great job. Who knew he could sing and play music? But he came in third for that Charles Wood Theater benefit. And he really did a great job. I was very impressed. So we have unknown talent in our county. And it's really wonderful. So kudos to him.
Thank you, Sue.
You're welcome.
And I would like to thank all of the supervisors for their devotion to your position during this time of the pandemic here that's so new to all of us, and it's a challenge on a day-to-day basis. You see it at your town, you see it at the county level, and thank you for all you do, because these are difficult times, and it really is appreciated. If there's no other comments, we will stand adjourned.
Thank you.